So this will be our last video that I'll be making on arrhythmogenic right ventricular cardiomyopathy, also known as what ARVC. Okay, so for the ARVC, we said that it's a condition where the muscles of the right ventricle, okay, so muscles are now being replaced by fat, and some cells are dying and there's scar tissue formation. Okay, so how can you be able to treat this kind of condition? All right, treatment for arrhythmogenic right ventricular cardiomyopathy. There's actually no established best treatment for arrhythmogenic right ventricular cardiomyopathy. However, excessive training or participation in sports must be avoided. Why? Because as you are doing all those sports and all that, it's now putting much more stress on the heart. This can lead to heart failure. All right. So our anti-arrhythmic options are used for what symptomatic benefits in patients with hemodynamically well tolerated ventricular arrhythmias. All right. Then radiofrequency ablation. Then all these implantable cardioverter-defibrillators can also be used. These are all those how do they call it? All those machines that will now be helping your heart to pump. Whenever they notice that the heart is going down, they trigger it and all the stuff, right? Then patients who have developed right ventricle with or without left ventricular dysfunction can be managed with what? Standard treatment for congestive cardiac failure. So the treatment for congestive cardiac failure can be applied on somebody that has what? An arrhythmogenic right ventricular cardiomyopathy. Then transplantation in severe cases might be indicated. All right, because come on, this part of the heart is almost gone. All right, so transplantation is actually what the best option for this kind of condition. All right, so those are the various what treatment options for arrhythmogenic right ventricular cardiomyopathy.